What does it take to make real progress? Good ideas at the right time. A lunchbox became the first hot air sterilizer. And from that, 75 years of innovation. With a commitment to continuously improving hygiene processes. From the first solutions to a coordinated system solution. From a single unit to a unique 4-in-1 innovation. Because progress is created together. As a team, as partners, as a family, and with over 700,000 medical practices by our side. Are you ready for the future? Then let's shape it together.
Ladies and gentlemen, hello and a very warm welcome to our MELAG webinar. It's really great to have you joining our webinar today, and it's really great that you are joining us as well, Romy. Welcome.
Thank you, Leonard.
My name is Leonard, and our topic of our today's webinar will be the correct treatment and reprocessing of dental rotating handpieces. Before we will start with our presentation, a small organizational note. During the whole time of our webinar, there will be a live chat function available. Means at any time when you have any kind of questions, comments, or would like to request further info, please use our live chat function, and our colleagues in the back will help you and support you at any time. Okay, Romy, I'm ready when you are ready. Let's start?
Yes, sure.
Okay, let's start. Once we are talking about the correct reprocessing of dental rotating handpieces, we have actually done a survey. We have asked a lot of dental clinics and practices what are actually the main challenges once we're talking about the correct treatment.
Yes, about over 60% of the practices said that the most challenging part is actually the protection of the instruments, meaning that, for example, the instruments are of course very expensive, and if they break, they have expensive repairs. You need to send them out. This is very inconvenient, so therefore it's one of the major challenges that they face. Additionally, and the second part, one of the challenges is the compliance with the international guidelines. Depending on where you're located, you need to check the local guidelines and make sure that your reprocessing process is, of course, ensures the highest standards and that you comply with the national guidelines. Yes. Last 2 points are, of course, the time management, because it's very important that you have the instruments that you need in a certain time. You need to manage that you have everything that you can use for your service in regards to the treatment of the patient.
Additionally to the survey with the dental clinics and practices, we have actually also asked the manufacturers of the dental rotating handpieces and turbines, and we have basically asked, okay, what do you think are the main reasons for high repair costs for those dental rotating instruments? And the answers are quite obvious. Actually 15% of the costs are coming from dropping off, from falling down of the instruments. But the main reason, with more than 50%, is actually the insufficient care, the lubrication, the oiling part. So the dental rotating, high-speed rotating dental handpieces, they need to be oiled and taken care of in a very good way. And once we are talking about these things, it's actually not only the inner side of the dental rotating handpieces, like the ball bearings. We also need to talk about the importance of the chuck care, which is, we will come to that later more specifically. So these are the main reasons what the manufacturers actually tell us are for the high repair costs. So it's quite interesting to see, and maybe to have a better picture what it actually means, good oiling, bad oiling, insufficient care. We have another slide where we go a little bit more in detail.
You can see here currently on the left-hand side how instruments that are well maintained should look like. On the right hand side you see the other side of the spectrum. So what are the reasons that it looks actually like this? One of the reasons could, for example, be that you underdose the oil of the instruments. There's no such thing that under-oiling in instruments. It needs to be oiled really well from the inside to make sure that everything is nice and lubricated. Especially you talked about high rotation speeds. We talk about 200,000 rotations per minute.
That's very fast, by the way.
Yeah, that's very fast.
Yeah.
And therefore, you need to make sure that the inside components can move really smoothly. Then, of course, another problem would be that you use the wrong oil. There's a difference in between the mineral oils as well as synthetic oils. With mineral oils, during the sterilization, they sometimes turn in like darker and sticky, and therefore not lubricating the inside of the instruments well enough anymore. So therefore, it's very important that you use high quality dental synthetic oils that can be penetrated by the steam during the sterilization, but don't change their texture, and therefore still lubricate the inside of the instruments really well. And of course, another problem would be, it's good if you lubricate the instruments, but it's really bad if they are not cleaned from the inside well enough. So poor interior and exterior cleaning could be one of the reasons, as well as you mentioned it already, the chuck care. It's very important that also the top part of the instrument is cared for and not just the inner channels. And lastly, of course, it's really important to always check what the manufacturer of the instrument recommends for the instrument to make sure that they have a long life.
Yeah, right, indeed. Once we're talking about the reprocessing cycle at the end, according to international guidelines, recommendation, might be laws actually, we need to have some kind of risk classification. Whenever we bring an instrument to the sterilization room, we need to be sure what kind of purpose this instrument is actually given us, that we see what kind of steps we need to do inside the sterilization room. And in an international context, the main classification is actually like a non-surgical use or surgical use, non-invasive and invasive treatments. And let us start with the non-surgical treatments, such as conservative instruments and treatments. What steps do you need to do to follow the hygienic cycle? It's actually, it all starts actually always with a cleaning and disinfection. And the automatic solution is definitely the preferred option. After the cleaning and disinfection, you should oil, lubricate, take care of your instruments inside, but also the important chuck care. And optionally, there might be a sterilization, and last but not least, a documentation and approval of the things you have done.
Yes.
Right.
And in comparison, you of course have the surgical instruments. Treatments would, for example, be extractions, osteotomy, implantations, PA treatments. And for those instruments, it is very important that an automatic cleaning and disinfection is required. So it's not optional or preferred, it's required.
Yes.
Afterwards, of course, you also do the oil care. Then you need to package the instruments and sterilize to ensure that the sterilized environment is, so no bacteria or viruses.
Yeah, like a sterile barrier system. Yeah,
exactly.
Right.
And lastly, of course, you also have the documentation and the approval process for the instruments.
Always the last step, so to speak. Right. I was already mentioning and talking about some kind of hygienic reprocessing cycle, and voila, here we are. Actually, it starts with the contamination of the instrument. So we treat the patient, we need an instrument, and therefore we have a contaminated instrument. Then, of course, we need to take care that we have a safe and secure transport from the treatment room into the sterilization room. And then it already starts with the cleaning and disinfection. Then we will go on to the inspection and maintenance, such as like oiling, for example, packaging of the instrument, steam sterilization. We will come to that points back later. Then the documentation and approval, the storage and the transport. And then actually you are allowed to use the instrument again. Right now, I would like to focus very clearly on the cleaning and disinfection point. And actually, if we take a look inside dental practices and in clinics, there are several solutions how you can actually do the step of cleaning and disinfection? Maybe you can tell us a little bit about it.
The first and classic approach would, for example, be using a washer and disinfector for the reprocessing of your instruments.
Yep.
The major advantage here is, of course, you reduce the workload for your practice, and therefore it means that you have a larger device where you can not only put your handpieces in, but also the other instruments and have them automatically cleaned. That means you don't need an extra device for the cleaning of your handpieces.
Yeah.
But as it is a larger machine and has a larger chamber, the cycle time will take a little longer, and also meaning that you of course want to efficiently use the device, you would have to have more instruments to fill up the chamber and have additional instruments for treatment units for the treatment of the patients.
Absolutely,
in the meantime.
right.
That means you have a larger inventory of the instruments, and of course after you reprocess your instruments and your handpieces in the thermal disinfector, you need to find another solution for the oil care of the instruments, which leads us a little bit to the second option that you have. You can also reprocess your instruments in care units. That means you have a specific smaller device, for example, for a very fast reprocessing only for handpieces, and also let's call them hollow body instruments. And that means they get reprocessed in this device, and then maybe you also have a solution integrated that oils the instruments as well. This is of course then a separate device that you have on your reprocessing room, therefore you need the space. And of course with an additional device you have extra maintenance to do for the device itself.
Yeah, makes sense,
Yes.
Right. There's actually one solution left, which is a 4-in-1 or all-in-one solution. So basically there is a device available, it's called CareClave, quite a unique solution that combines all the things we have just talked about. So it offers cleaning, disinfection, care, oiling, sterilization, documentation and approval in one device. So that's very unique, it's very special. You will have a lot of time and space advantages, service cost advantages. However, out of many discussions with dental practices and clinics, we have been faced that there is still a demand for a standalone lubrication unit, because you might have the situation that the practice has just invested in the Class B sterilizer 1, 2, 3, 4 years ago. So they don't need to have an all-in-one solution, they need to have a separate standalone solution. And yes, by saying that, we are leaving a little bit the educational part right now to talk a couple of minutes about a magical new solution that we are actually introducing live today. So it's a pleasure to introduce our new solution.
Yes. Welcome to our new MELAG Care. This is our new wellness for our handpieces, of course.
Yes.
No, it's a reprocessing device and a care device for your handpieces. That means we have,
I can take it out.
The MELAG Care has the possibility to be used with two different types of lids. We have the lid blue, that is for reprocessing and lubrication of up to 6 handpieces, contra-angle handpieces, turbines. And then we have the lid green. This is for the reprocessing of up to 6 scalars and scalar tips, ultrasonics, handpieces and spray nozzles that do not use lubrication. So those are the two lids that we have for our new MELAG Care.
Right. Blue including oiling,
Yes.
green without.
Exactly.
Right.
It's the same colors that we also use for our CareClave, so this is maybe something that you are more familiar with.
Yeah.
And the MELAG Care has the so-called care therm cycle, which makes it able for you to have the 6 handpieces or instruments reprocessed in very fast cycle times. Let's start around a quarter of an hour. Then if we add up this over the day, that actually means that we have up to 144 handpieces and instruments that can be reprocessed within this unit during the day.
Perfect. And we are always talking about inner and outside cleaning, inner and outside disinfection and lubrication.
Yes.
Wonderful.
That means, of course, you have a safe reprocession of the instruments after every patient. You also have a lower investment in regards to additional instrument sets that you need, because you can just use them in a higher frequency. And lastly, you have a high protection of the life of the instruments. They are well cleaned and well maintained to make sure that they run smoothly for as long as possible. Let's maybe have a look into how does a cycle look like for the MELAG care. What are the different process steps?
Yep.
The first one would of course be the cleaning. That means that thanks to our new ultraflow technology, the MELAG care uses compressed air to accelerate the feed water to efficiently clean the inside and the outside of the instruments, completely without any additional chemicals, and no cleaning agents are required for this
Chemical
device.
free.
Chemical free. And yeah, as a side note, additionally, as it is with our other MELAG devices, this device is really a high tolerance in regards to the feed water quality.
Means the filter of a water treatment system will last longer.
Yes, exactly.
Right. Perfect.
After the instruments are cleaned, we come to the next step, which would be the disinfection of the instruments. The MELAG care disinfects with a temperature of approximately 95 degrees Celsius, meaning that the disinfection is bactericidal, mycobactericidal, fungicidal, and fully virucidal. So perfect, all the 4 categories, we get them all.
Yeah, right.
In the next step, we have the oil care, as we mentioned, that is very important. That means that if you have your blue lid and your 6 handpieces, they will be oiled from the inside. And lastly, you have your drying and cooling process. Means we use our compressed air to dry the instruments, and then you have an integrated cooling that will take approximately 5 minutes for your instruments to cool down, so you don't burn your fingers when you take the instruments out, and you can use them right afterwards. That means that either you let your instruments cool within the chamber, or if you say, I need to start my next cycle a bit quicker, you are able to take off the lid, and then you have adapters so you can actually place your lid with the instruments to cool down on the side of the device. Depending on how your setup is, it's on the left or on the right hand side, so you're free to use that.
Means if you would have like several lids, you can make some kind of rotating system.
Exactly, yes.
Okay.
So you're highly efficient depending on your personal needs in the practice.
Yep.
Yes. And this actually brings us to the other features of the MELAG care, which will be, you have the 4.3-inch touch screen display, which allows you a very intuitive user interface, and is really, I must really say, I really love it because it's so easy to use.
Yeah.
And a nice side is also that we have our Pro Control function on the device. That means that you have your user management, you have your batch approval, and you also do have a digital documentation via the USB stick or a network. Yes.
Right, perfect.
And like we mentioned earlier before, the chuck here is something very important. With this device, we have a small adapter and have a solution that you can adapt this little adapter in this chamber on the inside, and then do a chuck here on the inside of the device chamber. That is really nice. And your oil can that is located on the side, so it's also really easy to exchange, is here, for example, our care oil. This will enable you a reprocessing of up to 1,000 instruments with 1 can of oil.
Wonderful.
And this, of course, in such a small and compact device, meaning the MELAG care is only 31 centimeters wide and 38 centimeters deep, and therefore it's really space efficient and just fits onto almost every reprocessing area.
Right, and we can see here a nice picture. You see a washer disinfector, Melatherm at 20. Then you do have this magical solution called MELAG care. Then we see a sealing unit And last but not least, the autoclave working from the unclean side to the clean side. So it's a wonderful setup to take best care of the correct treatment of both instruments. Not massive, but also, of course, that's the main topic of our today's webinar, the dental rotating handpieces. Right. Thank you very much for this explanation and the introduction actually of our new solution. Now we're coming back to the more educational part again, and we will remain for one slide at the cleaning and disinfection part, because once you're using an automated process such as a washer disinfector, there might be 3, 4, 5 steps that you need to take care of, and please explain.
Yes. First and foremost, I want to point out that is not one of the 5 steps, but step 0 would be please check your instruments on different markings on them. Depending on if they're allowed to be reprocessed or not, they have tiny symbols printed on them. You can see them currently on the left bottom corner of the screen. There's like a little shower head. That actually means that the device is allowed to be reprocessed in a thermal disinfector. If it does not have them on there, do not put it into your machine, because otherwise your instrument or your device might have a negative effects afterwards. And then there's those 3 little squiggly lines with the 134 degrees Celsius. This is the symbol that tells you that the instrument is allowed to be sterilized after it was disinfected. Therefore, always make sure that those symbols are in the instruments, and then we talk about the using a thermal disinfector. In regards to this, once you have your dirty instruments and you maybe are not ready to start your cycle, it is important that when you collect your instruments, to collect them in a box without disinfectant or water. Because what do we know about metal, even if it is stainless steel? If there is, like, for example, a small defect on the surface and you put scratch by just general use, or you throw them into your collective bin a little bit too optimistically, then it is maybe in a liquid that would lead to most likely to corrosion. Therefore, please, if you collect instrument, do it in a dry way, and do not collect them for longer than 6 hours. The second thing you need to take care of or be really aware of, never put your handpieces into an ultrasonic cleaner, because the vibration will actually damage the inside parts of your handpieces, for example the ball bearings. That is something that you really must never do. And then thirdly, when you use, for example, a thermal disinfector with an active cleaning agent, always make sure that this is citric acid based, because other agents might be a little bit too aggressive. Therefore, always check, only use citric acid based agents. And of course, if you put them in a thermal disinfector or any reprocessing device, it's also important that they are connected correctly. So there are different adapters available depending on the type of instrument that you use, that will ensure that not only water gets splashed on from the outside, but also will run through the inside of the instrument, cleaning it really well. And as a last step, of course, it would be that it is recommended to use a dry technology just to prevent corrosion, like that if a device has a drying function, to prevent any types of corrosion.
Makes absolutely sense.
Yes.
Right. One more important step is a filtering system. Once you are using some kind of automated process, and we're talking about water, for example, in a washer disinfector, and you have an injector rail with a corresponding adapters to place your dental handpieces and turbines, you need to be sure that no residues in the water will actually be like flushed with water pressure into your valuable instruments. So we need to take care that the water is filtered, and there are several technologies or ways how to do it right available on the market. Once it's a quite unique product, filtering product. It's called Cleanfinity Pro, which is an automatic self-cleaning centralized filter. There are other centralized filters available that have some kind of mechanical indicator that you know once you need, when it's like full, that you need to clean it by a manual brush, for example. And last but not least, coming a little bit from the past, actually are those like coins, this single filter plates that are included inside the adapters. Whatever kind of system you are using, make sure that you control those things and that you know, because they might have some kind of lifetime cycle. So read again the instructions of the manufacturers, it's very important, and then everything's gonna be all right. Right. Another very important part, once we're talking about the shape or the use of a dental rotating handpiece, is that we do have dental handpieces that might be used for surgical treatments, and they are like manufactured to be a special surgical handpiece, and they might have an external cooling channel, and also this external cooling channel is defined being a like hollow body. So we need to take care of that as well. So we need to have some kind of specific adapter, and we have here a wonderful slide where we can see that for several solutions, such as CareClave, such as MELAG, such as the Melatherm 10 Evolution or Melatherm 20 units, we do have a corresponding adapter that is taking care of those external spray channel as well.
Yeah.
Right.
That actually means that if you're, for example, thinking about buying a new device and you use this type of instruments, always make sure that the new reprocessing device offers a solution, because not all of them do. And therefore it would be really bad if you buy a new device to reprocess your instruments and then have the challenge that you don't have an adapter for the external spray channels.
Right. Yeah, that would be, right. You need to take care. Coming back to the hygienic cycle instrument reprocessing, now we are leaving the cleaning and the disinfection part. Now we are coming to the inspection and maintenance. We talked a lot about like oiling, and also here it sounds so easy to take care of your instrument, but it's again the devil in the detail. So please tell us a little bit more about the oiling part, lubrication.
Of course, the first and most important part is that you check your instruments before you put them into your reprocessing process. That meaning that after you've cleaned it, you need to check again if there's any damages or if there's any surface altercation, because if you, for example, have rust on your instruments and you put them in the sterilizer, rust is like an infection. It will stick and cling to your device, maybe your sterilizer, or also your other instruments. So the first step would be check your instruments again and discard any damaged instruments or instruments with altercated surfaces such as corrosion or rust. This is easy to detect if you, for example, use a magnifying lamp. So it's very advisable to have such a lamp. And then, of course, before oiling the instruments, you always need to make sure that they are dry, not only from the outside but also from the inside, because where there's water, the oil cannot reach, and therefore some devices offer, it will blow out the instruments with compressed air in the process. For example, the MELAG does it. And for some that don't offer the solution with the compressed air integrated, you would have to do it manually by hand. And afterwards, of course, you oil your instruments with the correct type of oil. Like we mentioned before, please use a sterilizable oil according to the manufacturer's instructions, meaning how often you do it. If you have your instrument within the thermal disinfector, of course, also the oil is being washed out. So that would mean afterwards, please oil the inside. And as we mentioned, point number 5 would be the chuck hair. Perform a chuck hair. We generally recommend doing it at least once a week, but if the manufacturer says it's more often necessary, then of course, please follow
again, check out the instructions of the manufacturers. Very, very important.
Yes, in regards to oiling, of course, the manual solution may be shown on the screen here, and like I mentioned before, later on we will also show you on how to do it with our new adapter in the MELAG here.
Wonderful. Okay, next step in our hygienic cycle, workflow for handpieces mainly. Now we're coming to the steam sterilization part. Once we have like surgical used instruments, we need to seal them in, to wrap them, and then we need to place them into a steam sterilizer. And of course we need to check the correct loading. The paper side should be down,
Correct.
And this is valid for all kind of instrument. Doesn't matter if you're a hollow body instrument or massive solid in instruments, paper side down, please. If you see any kind of like remaining dirt or oil in the chamber, please make sure that you get rid of all these dirt and remaining oil, because the oil, it should be like on or inside the instrument, but not in the sterilization chamber. So there are several like products and solution tools available to get rid of those like spots, dirt or oil, for example, chamber protect. So there should never be any kind of dirt or oil remaining in the chamber of the sterilizer. Then of course, depending on the load, wrapped, unwrapped instruments, hollow body instrument, non-hollow body instrument, we need to choose the correct program according to the load. Mostly common is probably inside dental clinics and practices the so-called universal program. However, there are quick cycles available, quick S and quick B cycles. Right, and last but not least, it's more and more common, also in an international context, to have an external control of the sterilization parameters. So therefore, it's more and more common to use something like an indicator, so-called helix test, for example, that is checking all the parameters, including the vacuum, that you can really be sure that your sterilizer is doing a good job at the end. Next step in the reprocessing cycle would be the documentation and approval. This is actually valid for each step. You need to have some kind of proof that you have done the work correctly. There might be a cleaning and disinfection protocol. You talked about the USB and network connection, also available for MELAG. We need to talk about maybe a sealing protocol. We should talk about the sterilization protocol. So any kind of documentation that will have some kind of proof is highly recommended.
Yes, and in regards to how long do I actually have to keep the documents? And if you would do it manually, it's recommended to at least retain the documentation for 5 years. Some countries even have longer periods of time. For example, I think in Germany 10 years is common, in some cases even 30. And those documents will add up for the cycles, and therefore it's highly recommended to document this in a digital form. As you mentioned, a lot of devices on the market offer this solution. Our devices do it too. And then once you've documented the correct reprocessing and sterilization of the instruments, you have for us maybe a little like a little label that is onto the packaging of the sterilized instruments. You can use this, and it's advised to transfer it into the patient's file once it is used, just to make sure that the entire process and the single instruments which was used with the patient is documented in his file as well. So it's 100% traceable.
Like a tracking system.
Exactly. So how does it look like? Maybe let's head on, just go through the cycle really quick to show you how easy it actually is. Like Leonard already mentioned, you first choose your program. Then when the device has a user authentication, you can set up that the user has to enter a 4-digit PIN, which will be documented in the protocol as well as onto the label that is stuck onto the instruments after it is sterilized. And then you have to say, for example, did the indicator change?
Like the helix test, for example?
Like the helix test. And you continue, and then you say, does do the instruments look good? Is the packaging all right? Is everything dry enough? Do you think this batch can be released, or this instrument? And then after you say, yes, it looks good, I want to release it, you can set the number of how many labels you want to print out. That means, for example, if one of the packages that you have inside, you have maybe in your sterilizer 15 instruments, and one package just did pop open, then you can say, I only want to print out 14 labels. You print them out, stick them onto your instrument packaging, and afterwards, you just, when you use the instrument, scan the code and document it in the patient file.
Wonderful. Right. For now, Romy, thank you very much for all of your support. We're coming now to an end of the educational part, but please stay tuned, because we will go on with chapter 2, which is actually the Q&A session. And you have used our live chat function quite actively, so thank you very much. And there seems to be like 3 main points that have been asked several times. We start with the first point is like if we could again show maybe a little bit more in detail how the chuck care actually takes place in a MELAG care.
That I will likely do. Like I mentioned before, we have our chuck care adapter located on the right hand side of the device. Afterwards, you just take off the blue lid. There's a tiny arrow which is located right at the front of the adapter. You place it on the right top corner of the chamber, set it onto the black outlet, and then you just twist about 90 degrees. The adapter will actually click in place.
Okay,
and this is, then you use your handpiece that I have here. Maybe you have a tissue, of course, as well. You will place your instruments right at the little nozzle of the adapter. And then you press your chuck care on the display and you activate it. A very important thing is make sure that you place it correctly on the adapter, because the oil will be pressed with compressed air into the instrument. So if you don't have it closed up and maybe press it just for fun, it might be a little bit messy. Therefore, always make sure it's like pressing an open can bottle. You don't want to have this in your practice.
And the amount of oil is like preset, huh?
Yes, the amount is preset. It takes about 5 seconds. So it will also show you on your display how far along you are, and therefore you know when to place it and how to do it. There are small instructions also given to you on your display.
Okay, great, wonderful, wonderful. Next question that has been asked quite often is like, hey, now you offer basically 2 good solutions, which is CareClave and MELAG Care. So for which kind of customer practice clinic, which option, which solution should I choose? So and just to clarify a bit, once you are a new practice and you want to invest into the best possible setup, because you think about workflow, you want to save space, you want to save costs for service. The CareClave is a wonderful magical solution. We talked about the device, which combines 4 or even 5 steps in one unit. Means it's a cleaning, disinfection, lubrication and sterilization unit at the same time. However, if you have already done an investment in the recent years, 2, 3, 4 years ago, you invested into a Class B sterilizer, there is no need for an all-in-one solution. And if you have that kind of demand, then of course a separate lubrication unit, cleaning, disinfection and lubrication via MELAG Care would be the best choice for your type of practice. That is like one point that you need to consider. Again, when you might have some space issues, that your sterilization room is a little bit smaller, and you are looking for every kind of centimeter that you might be able to save, then of course again a CareClave would be a good idea, because when you have like 2 units, a lubrication unit and an autoclave, you easily need 90 centimeters approximately space for placing the units. If you have a CareClave, the space that you need is much less. So this would be like a point to consider as well. Right. Last but not least, we have mentioned it a bit in between. It's like, once again, now coming back to MELAG Care again, what kind of installation requirements do we actually have? So I would like to choose MELAG Care and to invest into MELAG Care. What do I need to do? So
as a general setup, you would need, of course, your electricity. You would need a compressed air adaptation, and you need to be able to connect to some sort of water system. It could be either you use, for example, Meladem 47 or Meladem 53. That is something that we require, and also a wastewater connection. Or one alternative solution would be that the MELAG Care can also use external canisters for feed and wastewater. This is the other option that we have. But in regards to this, you need water, electricity, compressed air, and then wastewater connection.
Yeah, more or less a basic setup, which should be available in almost every sterilization room. Right. Thanks again. Now also these questions have been answered a little bit more in detail. I think now it's time, Romy, that we say goodbye. Best regards from Berlin. Thanks again for joining us. Have a great time. Thank you.
Thank you. Bye-bye.
After all the stressful treatments, I'm finally looking forward to our short getaway.